Hello students, we will come across very common condition in the perianal region which many patients present with the pain and other thing. So just to identify what this condition is, this area, perianal region, this is the anterior, the posterior aspect. See this area, what is this condition is, because you can see a longitudinal ulcer there in the posterior anal canal, lower anal canal. Here it is in the posterior. So it is fissure in ano. It is longitudinal ulcer in the lower anal canal. This is the definition of the fissure in ano. What are the features? Common in midline posterior, can be anterior, common in female. This point is very important, especially starts in pregnancy and after delivery it continues. So quite common in females, especially anterior one is common in females. Posterior also can occur. Other than that, it is common in constipation patient, harder stool, where stool is not proper in patient. And sometimes that is the other specific conditions like Crohn's disease, ulcerative colitis and so on. Constipation, hard stool, Crohn's disease, ulcerative colitis, tuberculosis, post-hemorrhoidectomy, after hemorrhoid surgery, while during staining they may develop fissure, remember. What are the types? Acute and chronic, these are the types, acute and chronic. So this is acute type, see that? Redness, all around edema is there, superficial. This is the acute type, posterior, this is the anterior, this is the posterior part. It's acute type. There is severe excruciating pain. You can't do proctoscopy in this patient. Even per rectal exam is difficult, very, very painful, very sensitive. And presentation is acute, severe excruciating pain. In those patients, do not do rectal examination. Only inspection is possible. You will never do rectal examination. In chronic type, bleeding, mass per renum, itching, pain, discharge, whatever I have mentioned here, with the hypertrophic papilla proximally, fissure ulcer, distal sentinel pile. Now, if this is the ulcer, like this longitudinal ulcer, here proximally there is hypertrophic papilla. Distally there will be sentinel pile. So this is the fissure, this is the sentinel pile, this is the hypertrophic papilla. This is the anatomy of the chronic fissure in ano, pathological anatomy of the chronic fissure in ano. So this is how exactly looks like. See hypertrophic papilla here, ulcer here, sentinel pile here. So what are the available treatment? Sits bath, very common, warm water, patient has to sit for 15 minutes so that it cleans the area, it reduces the edema, reduces the itching, it also promotes the healing. Medicines, laxative diet, topical applications. Remember, don't apply steroidal applications because it causes delayed healing. Eventually, when you do surgery in such patient, healing will be delayed because of the repeated steroid application. Lateral sphincterotomy, recamier's anal canal stretching, not Lord's dilatation. Lord's is 8 finger, recamier's stretching is 4 finger. Lord's is 4 each, 8 finger. You don't do that now. This is 8 finger, this is 4 finger. Stretching is okay. Dorsal fissurectomy, the sphincterotomy, and sometimes in advanced large chronic cases, local advancement collapse. So this is very commonly done, lateral sphincterotomy. Sometimes stretching you can do. Fissurectomy in a chronic fissure like this, you have to do stretching. You have to do dorsal fissurectomy, not, of course, don't do Lord's dilatation, that is, even though practiced earlier very commonly, but currently it is said that it may injure the fibula rectalis. So anal stretching is okay, lateral sphincterotomy is good. Dorsal fissurectomy is okay in a chronic cases, remember. So my clinical methods in surgery, please go through that with the video lectures of exams, all topics. My manual covers everything A to Z for CBME, UG and postgraduates with case scenario, MCQs, detailed text of every topic, every subject. Actually, my operative surgery with the 2 volume extensively discussed a small minor procedure to big procedures, illustrations, photos, everything. And tissue approximation gives how to do suturing, very useful for beginner or learner or otherwise also consultant. And my DigiNow video lectures through JP covers all UG topics, including urology, cardiothoracic, neurosurgery, and clinical examination. It also covers operative surgery instruments, pathology, X-rays, images, and so on. So students, I hope you have understood fissure in a very common topic very well. Thank you very much.